amigos, my name is Cedie and thank you so much for watching this video. And for today, we're going to have another lecture discussion on some mental disorders, giving you the signs and symptoms, the diagnostic criteria, and the treatment plan for every disorder. I hope that this video is useful for you, and please, if this is your first time to visit my channel, please do subscribe at my channel and hit that bell button for you to get notified whenever I post a new video. Guys, welcome again to another lecture discussion we have. So for this time, we're going to discuss obsessive, compulsive, and trauma-related disorders. So OCD. Sino bang mga OC dyan? So OC is a common term that we use and sobrang bugbog na yung term na always ating ginagamit when we see a person that is really organized and so on and so forth. But OC can be a form of mental disorders. Okay, so under obsessive compulsive and trauma-related disorder cluster, we have various disorders. Of course, we have OCD. We also have body dysmorphic disorder. We also have hoarding disorder, trichotillomania, excoriation, and post-traumatic stress disorder under the trauma-related disorders. Okay, so ayun. So let's focus more of the OCD, obsessive compulsive disorder. So, this is a type of anxiety disorder which is represented by a diverse group of symptoms that include the intrusive thoughts, the rituals, preoccupations, and compulsions. So, basically, obsession and compulsion. Let's define those two terms that make this disorder a disorder. Alright, so when you have obsessive compulsive disorder, there are recurrent obsessions and compulsions that causes you severe distress. Okay, hindi ka mapakali. The obsessions or compulsions are very time consuming and this will interfere significantly with your normal routine, your occupational functioning, your usual activities, alright? And usual social activities and even your relationships. A patient with OCD may have an obsession or compulsion or pwede rin sabay. Obsession, compulsion. Okay, when you say obsession, these are the intrusive thoughts or recurrent thoughts or feelings, ideas, or sensation that are uncontrollable and persistently you feel. For example, there is this obsession that you need to really double check those locks just to make sure if talagang lock siya. That is an example of a thinking that always reoccur to you over and over again, that you need to check this, you need to check this, that there is this thinking that, uy, baka hindi pa close yung pintuan, baka hindi pa nalock yung kotse. Yun yung intrusive and always recurring thoughts sa atin. Compulsion naman, in contrast with this obsession, this is repetitive and clearly excessive behaviors or mental acts that the person feels driven to perform to reduce the anxiety. So specifically, this is a conscious, standardized, and recurrent behavior such as counting, checking, or avoiding. For example, kapag you have the thought na hindi pa lock yung kotse, so uulitin mo yun. So babalik ka dun. So you need to really double check, triple check just for you to make sure, just for you to reduce that anxiety feeling na talagang lock na yun. And sometimes also like double counting your money if sure ba talaga that yung pera mo is 20 pesos. So you need to recount it again over and over again just to check, triple check, double check. Alright. So, ang daming bagay. So, compulsion is a behavior for you to reduce that anxiety you feel. Okay? It's like a reaction from your obsession, from that intrusive thoughts. Okay? This tends to begin at either before the age of 10 or else in late adolescence or early adulthood. So this can be described sa mga bata as young as 2 years old. This is slightly more common to women than to men. So sa girls pala, mas common ang OCD. OCD is a chronic disorder. This can also comorbid with other anxiety disorders, major depression, substance use disorder, and even hoarding disorder. Okay, so most commonly reported compulsions include pursuing cleanliness and orderliness, sometimes through rituals. So may palagi kang ginagawa para maging malinis, ganyan. So performing repetitive, magically protective acts, yun pala may mga magic or rituals kang ginagawa such as counting or touching a body part, and even repetitive checking to ensure that certain acts are carried out. So pa-check ka, paulit-ulit, pabalik-balik. Ganito po yung OCD. Alright. So let's go deeply sa OCD. The compulsive act may be carried out in an attempt to reduce the anxiety associated with that obsession. So it does not always succeed in doing so. Again, so that compulsion is a response from that obsessive thought. The completion of that compulsive act may not affect the anxiety and may even increase the anxiety. Ito lang po. So anxiety is also increased when a person resists carrying out a compulsion. Okay, so this is the OCD cycle. First, you have that obsession. Obsess kang, you have that obsessive thought. You have that intrusive thought na hindi tama yung pagbilang mo sa pera. So you feel anxious. You go with that anxiety. Okay, so you feel worried na baka mali. And so with that, and with that feeling of that anxiety, you have compulsion. You have this compulsive behavior of checking it, double check, triple check it again, just to make sure that you have the right amount of money. And because of that, you have that relief, okay? You have that temporary relief, okay, na tama pala yung ginawa mo. The money you count is correct. Alright. So repetitive checking is to ensure that certain acts are carried out. Okay, let's move forward. Alright, so a lifetime prevalence in the general population estimated is at to 2 to 3%. So OCD is the fourth most common psychiatric the diagnosis. So very common pala yung OCD after phobias, substance-related disorders, and major depressive disorder. Very common po yung OCD. Okay, among adults, men and women are equally likely to be affected by yun. So, OCD occurs less often among blacks than among whites. Let's move forward towards those biological factors. So, serotonin po yung the neurotransmitter being affected towards obsessive compulsive disorder. Alright. Alright. So, aside from OCD, we also have body dysmorphic disorder. Just to have a short definition, this is an imagined or exaggerated defect in the appearance. So, for most women, they focus on their skin, the hips, the breasts, and the legs. For men, they focus on their height, the penis size, and the body hair. So, patients that have OCD, the major treatment we have is SSRIs. So this is selective serotonin uptake inhibitors, since serotonin is the neurotransmitter that is involved in OCD. Alright, so it has its side effects, but pharmacology really gives you that good effect on the long run. Of course, behavior therapy is very essential if you have OCD, like CBT, exposure and response prevention, desensitization, and thought stopping, flooding, adversive conditionings, and psychotherapy. Okay? So that's all for today. I hope that you learned something about OCD, and if you have any questions, please feel free to comment it down below. I would be very um, I would be very happy to answer your questions if you have. Thank you so much for listening, you guys. I hope that you learned something. See you soon. And that's all for today, my egos. Thank you so much for watching. I hope you share this to others, and don't forget to subscribe.